topic that I got is actions of antibodies. Actions of antibodies is the meaning of action of antibodies is something that there's a type of actions in antibodies. So antibody was also called immunoglobulin, a protective protein produced by the immune system. It is to respond to the presence of foreign substance, which is called an antigen. So in our bio textbook, we learn 5 types of actions of antibodies, which is agglutination, neutralization, precipitation, opsonization, and lysis. So agglutination comes from a Latin word called agglutinate, which means gluing to. So like we learned before, agglutination is also like sticking together. So in the antibody, it is the clumping of cells, such as bacteria and or red blood cells in an antibody. So the antibody will bind into multiple particles and join them, creating a large complex or a clump. By this agglutination, it helps phagocytosis, which is like the eating of the cell, eating of bacteria, something like that, as large clumps of bacteria can be eliminated in one pass. So agglutination, they combine everything, and then the phagocytosis can just eliminate everything in one pass. The second action of antibodies is neutralization. What is neutralization in the action of antibodies? It is an antibody that defends a cell from a pathogen or infectious particle by neutralizing any effect it has biologically. So it renders the particle so that it's no longer infectious. Like if there's a virus, it will be no longer infectious if the process neutralization occurred. And then is neutralization normal? It is very normal, and it is part of the humoral response of the adaptive immune system against viruses. And then the picture in the middle is example of neutralization tests. Take a look, the textbook also got. So the antibody will combine and to prevent from touching the red blood cell. And the third action of antibodies is precipitation. Precipitation only occurs when the antibody react with dissolved antigens so that it forms a insoluble complex, which is then called a precipitate, that is easily destroyed by phagocytes. And then the graph there you can see, when the amount of antibody precipitated increases, the amount of antigen is also added.
Okay.
So the graph there you can see that the curve is when the zone of antibody access, zone of equivalence, and when is the precipitate form. It's a bit more detailed in this graph. And the fourth action of antibodies is opsonization. So antibody opsonization is a process by which a pathogen is marked for ingestion and destruction by phagocytes. So this process of actions of antibodies, opsonization, it involves the binding of opsonin, example antibody, to an epitope on a pathogen. After opsonin binds to the membrane, phagocytes are attracted to the pathogen, which eats it.
Okay.
And the last action of antibody is lysis. Lysis is a simple one. I think it's connected to opsonization. It combines with the antigens and causes the bacteria to be broken down and decompose. So when a lysine antibody combines with an antigen, it forms something called bacterium. When it undergoes lysis, lysis is like decomposition. So when it undergoes lysis, the bacteria dies, then it's gone. It won't be in the body. So, and then the 5 pictures is what to do with these 5 things. So the last process is opsonization and phagocytosis, which is then the end.
The second line of defense consists of fever, inflammation, phagocytosis. For the third line of defense, it consists of antibody and memory cell. Okay, so the second line of defense, the fever increases phagocytic activity and fight against microorganisms that infect the body. While phagocytosis, the process which microorganisms or other particles like dead cells are trapped and digested by phagocytes. When infection occurs, phagocytes move to the infected area and enter the tissue fluid through the pores of the capillary wall. When the phagocyte encounters a pathogen, phagocyte will engulf the pathogen, and the lysosome in the phagocyte will digest the pathogen like the picture shown on the right. That means the picture which is engulfing the bacteria. Okay, so this is the phagocytosis stages, a simple version I found on the internet. If you want to see the complete version, please refer to your textbook.
Yeah. Okay. Continue.
So now I'm moving on to inflammation. Inflammation is the immediate response that destroys and neutralizes harmful actions of microorganisms and toxins at the early stage of infection. The inflamed area will swell, turn red, and feel painful. So now I'm going to explain the inflammatory response. The damaged tissue releases histamine. What is histamine do? Histamine will stimulate an immediate inflammatory response. Histamine will cause the blood capillaries to expand for more blood to flow to the infected area. While the second step is histamine also increases the permeability of blood capillaries to phagocytes. The phagocytes and clotting factors will accumulate in the infected area. So the third step is the blood coating mechanism is triggered, and the last step is the phagocytes carry out phagocytosis.
Okay.
So now I'm going to move on to the third line of defense, which is the immune process of the lymphocytes. Lymphocytes form in the lymph nodes produce antibodies. Each type of antibody can combine with a certain type of antigen as shown in the picture on the right, so that each antibody can combine different antigen at one time only, like antigen A or antigen B, whatever antigen you can think of lah. Then when a person is infected with pathogens, a large number of lymphocytes will accumulate in the lymph nodes to destroy the antigens and foreign particles like the bacteria, all those things lah. This will cause the lymph nodes to swell. The lymph nodes contain macrophages that destroy bacteria, dead tissues, and foreign particles through phagocytosis. There are two types of lymphocytes, which are T lymphocytes and B lymphocytes. T lymphocytes attack cells infected by pathogens, while T lymphocyte also stimulate B lymphocytes to produce memory cells. The memory cells will be stimulated to produce antibodies immediately if the same pathogen attack your body again.
Okay.
So I'm going to make a very quick conclusion of this slide lah. The second line defense includes fever.
11.3.1. So, introduction. There are two types of immunity, active immunity and passive immunity. Both of these types of immunities can be obtained naturally or artificially. What is active immunity? There is natural active immunity and artificial active immunity. Natural active immunity is acquired after an individual recovers from an infection. Artificial active immunity is acquired when an individual is given a vaccine injection. And there is passive immunity. Natural passive immunity is acquired through breastfeeding from a mother to the fetus during a pregnancy, and artificial passive immunity is acquired through an antiserum injection. Okay, active immunity. So in active immunity, antibodies are produced naturally through lymphocytes, and it remains for a long period of time. Natural active immunity is that when you get infected by pathogens, lymphocytes will produce antibodies as a response to these antigens. And when you recover from the infection, you will gain a permanent immunity against the disease. So that means you cannot get that disease again, and you are safe from it. And if you are attacked again by the same pathogen, the lymphocytes, the memory cells, will rapidly produce antibodies to react immediately against antigens so that you won't get affected by it anymore. Now, active immunity. Artificial passive immunity. So what is it? It is to protect oneself from being infected by a highly infectious disease so that you can be immunized against it. Immunization is a process that stimulates immunity against a specific disease through vaccine injection. A vaccine is a suspension of pathogens that are weakened, dead, or non-virulent. When the vaccine is injected into the body, the vaccine will stimulate lymphocytes to produce antibodies to fight against the pathogens. So every time when you get the first vaccine, it will result in low levels of antibodies, antibody production, and it is not enough to cure you from the disease and to protect you. So they have to administer a booster dose to increase the antibody production, which will lift the level of the immunity so that you can actually be protected from the disease. If you are infected by the actual pathogens, the lymphocytes will produce enough antibodies and immediately destroy it. So passive immunity. The body does not produce its own antibodies. This is for passive immunity. The bodies are from external source, which means it is not found inside your body, but it has to be administered from outside by doctors or pharmacists. This passive immunity does not provide long-term protection, but it's very fast, immediate, short-term, and temporary. So natural passive immunity. It is acquired by a fetus when the mother's antibodies diffuse through the placenta into the blood flow of the fetus. And these antibodies will protect the baby for the first few months after the birth through antibodies that are found in the mother's milk or colostrum while breastfeeding. So artificial passive immunity. This is acquired through an anti-serum injection or serum that contains specific antibodies to fight against specific antigens. So that means it's not random antibodies to fight like a specific antigen. It has to be very specific, and it is for this one and only type of antigen that it will work against. So this anti-serum injection will give immediate protection, but only for a short period of time. There are many types of anti-serum, such as anti-tetanus, anti-rabies, and anti-serum for poisonous snakes. That is all.
So I would like to proceed to 11.4, which is health issues related to human immunity. As you may know, there are a few types of health issues in regards to the human immune system. So for example, we have acquired immunodeficiency syndrome, AIDS, systemic lupus erythematosus, SLE, and allergies. So first of all, we like to look at acquired immunodeficiency syndrome, which is also called as AIDS. So this is the introduction. So acquired immunodeficiency syndrome, AIDS, is caused by the human immunodeficiency virus, HIV. HIV attacks and destroys the immune system and causes the human body to become unable to fight diseases. T lymphocytes act as host cells for the HIV virus. The virus attacks and multiplies within these cells and destroys the lymphocytes. Therefore, the body is unable to produce antibodies against HIV. HIV infected individuals will not show any symptoms for several years. This is due to the long incubation period of the HIV virus. However, this individual is a HIV carrier and can infect others. After 8 to 10 years, the patient's immune system becomes weaker and begins to show a variety of symptoms, including weight loss, fatigue, cough, and chronic diarrhea. Patients may also have cancer or fungal infections. Because the immune system has been weakened, the body can be easily infected by diseases that are harmless. Finally, when the immune system is paralyzed, the patient will die from other infections. So basically, what this thing does is when this virus gets inside our body, or we get into contact with this virus basically like kills our immune system by time. So for instance, it says 8 to 10 years. So after 8 to 10 years, after like we got in contact with this virus, we will become weak in terms of our immunity. So if our immunity is destroyed, so it's much easier for us to get infected by other types of viruses. Like there's a lot. So yeah. So transmission of HIV. So HIV can be transmitted through body fluids such as semen, tissue fluid, blood, breast milk, and vaginal fluid. Infection occurs during blood transfusion from an infected donor to a healthy recipient. B. While having sex with a HIV carrier without without any form of protection such as condoms, when sharing contaminated needles with a drug addict who is a HIV carrier, during childbirth or during breastfeeding. HIV transmission to fetuses and newborns can be avoided with certain medical treatments while the mother is pregnant and during birth. So we have already done the HIV part. So this is the second one, which is systemic lupus erythematosus, SLE for short. So systemic lupus erythematosus, SLE, is an autoimmune disease in which a person's immune system attacks their own tissues and organs. Symptoms of SLE include joint pain, chest pain, fever, mouth ulcers, and rashes on the face. The exact cause of SLE is unknown. Um, I guess the scientific name of this thing is called systemic lupus erythematosus, SLE. But I actually researched it about it a little bit, and it seems that you can also call it just lupus, and it's kind of a common disease nowadays. So it's basically an autoimmune disease. So in which a person like it just attacks their own tissues and organs. Yeah. Okay, so we are done with that. So we go to the third one, which is called allergies. It's quite common. Okay, so an allergy is a body's immune response towards a substance such as certain food, such as like seafood. Some people are lactose intolerant, so that means they cannot take, which is like milk or any type of dairy product like that. Seafood, like myself. Some people can't eat like certain types of like um vegetables, I guess. I don't know, but yeah. Certain food, pollen, from the smell, or like I don't know, the smell of the flowers, animal dander, and dust. Some people are allergic to dust. The responses include skin rashes, eczema, sore throat, swollen eyes, and itchiness. The pictures are there. So both of the pictures are just skin rashes. But I guess you guys know what do you mean by sore throat, swollen eyes, and itchiness. Sore throat is basically like you get like your throat is like sore, swollen eyes, your eyes become swollen, and itchiness you just feel itch all over your body. So that's like allergy is basically the way your body immune response towards like certain types of things. It might be genetic, it might not be. So yeah. So these are the preventative measures for all these three health issues related to human immunity. So first of all, let's see acquired immunodeficiency syndrome, which is also known as AIDS. So one of the preventative measure that can be taken, this is just for the public, just for generally, is sexual intercourse can be done with protection such as condoms. So I didn't like have say like you should inject from a drug addict, because like we're not going to talk about that. So it's like a general preventative measure. So that's the only one I can think of. So yeah. So second of all, we like to see systemic lupus erythematosus, SLE. So SLE, actually, it's not in the book, but I researched about it a little bit, and it seems that SLE can't be necessarily prevented, but the factors that trigger your symptoms can be avoided. So, for example, limit your time in direct sunlight if sun exposure causes a rash. So, if you're if in when you're like when a rash causes because of sunlight, so you can just put like like sunblocks, or like you should like limit the time. So you should always wear a sunscreen with the SPF of 70 or higher that blocks both UVA and UVB rays. So it also and second of all, you can also develop stress management techniques. So for that, you can meditate, you can practice yoga, or get massages, whatever that helps to calm your mind. So yeah, whatever helps to calm your mind is basically stress management techniques. So that's all for that. And number third is allergies. So allergy, if the individual does not know what food or substance that give food substance or thing that gives them an allergic reaction, then they should conduct an allergic test in the hospital. Actually, yes, I just realized that there is a thing called allergic test, and you can basically like if you don't know what is your allergy, but you know that you're getting allergies, you can take a test and you can just rule out what are you allergic to. So if the individual does know which food or substance or thing causes them to have an allergic reaction, they should not come in contact with it or any cause. You should not consume. If it's a food, don't consume it. If it's a thing, you should not get in contact with it. If it's dust, you should wear a mask, and etc. So, third of all, if the individual comes in contact with specific food or substance or thing under various circumstances, they have to take allergy medications. So you don't need to go to the doctor if the allergic reaction is not the severe. You can actually take like allergic medications such as cytosine, Zyrtec, and it's Benadryl, Zyrtec and Benadryl. So Zyrtec is the one commonly used in Malaysia. Benadryl, I don't know about Benadryl, but Zyrtec is the one that people like in Malaysia people always use. So if it's not that severe, just take this medicine. If it's severe, if it's really noticeable, if it's really bad, you should go and seek medical attention. So yeah, that is all I have today. Thank you.